Welcome to the Psychology Talk podcast. I'm your host, Dr. Scott Hoy. The Psychology Talk podcast is a unique conversation about psychology and behavioral health from around the globe. We help you expand your knowledge by connecting you in conversation with experts in the field. Topics include hypnosis and mind-body treatments, breakthroughs in neuroscience and psychology, social and ethical considerations of behavioral health and psychology, and international trends in mental health and wellness. While you're listening, please take a moment to subscribe to us and give us a like or a review. It helps us to grow and continue to provide you with quality information and interviews. And now, here is the episode. Hello and welcome to the Psychology Talk podcast. Today my guest is Dr. Gary Elkins. Dr. Elkins is a professor of psychology and neuroscience at Baylor University and the director of the Mind-Body Medicine Research Laboratory, where he conducts research into mind-body interventions, including hypnosis, mindfulness, and music for sleep, pain, and hot flashes. Dr. Elkins is the leading researcher and expert on hypnosis for hot flashes and sleep disturbances, as well as other clinical applications. He is an adjunct professor at Texas A&M University College of Medicine and a medical associate with Baylor Scott and White Hillcrest Medical Center. Dr. Elkins is the co-developer of the Evia app that provides hypnosis intervention for hot flashes and sleep that is provided by Mindset Health. Dr. Elkins serves as editor-in-chief of the International Journal of Clinical and Experimental Hypnosis. And he also has a current title that is just published a couple weeks ago, The Introduction to Clinical Hypnosis. Dr. Elkins. Gary, welcome to the show.
Thank you. I'm happy to be here.
Excellent. Well, maybe you can give a little bit of an introduction about yourself and how you got involved in all of this amazing research into hypnosis and mind-body techniques.
Sure. So I had worked as a clinician, as a clinical health psychologist for many years at Texas A&M University College of Medicine and Baylor Scott and White Medical Center. Primarily providing hypnosis and related interventions for individuals dealing with health-related problems such as anxiety, post-traumatic stress disorder, chronic pain, and those kind of problems. And really the turn toward a academic and research career occurred going back to about 2003. And at that time, I was conducting a study of hypnosis intervention for pain management among patients with cancer and associated pain problems. But in 2003, there was a large study conducted by NIH, National Institutes of Health, called the Women's Health Initiative Study that was designed to examine the benefits of hormone therapy for women who were in the menopause transition. That study was halted early when it was found that hormone therapy, meaning estrogen and progestin, led to an increased risk of breast cancer and cardiovascular disease. There was a need then for non-hormonal alternatives so that women could have a choice and that they could have a safe choice. And so I began to investigate and develop a hypnosis intervention for reduction of hot flashes and to improve sleep. The findings were impressive, meaning that on average, a 70% reduction in hot flashes were shown. And so that led to a series of randomized clinical trials and further funding by NIH to develop and determine the efficacy of this intervention of hypnosis for hot flashes.
Okay, excellent. Well, maybe you can talk a little bit about that. Like, how did you come up with the intervention, the suggestions or whatnot? Like, Did you just kind of reverse the process of the hot flashes, and or how did you go about? What kind of interventions were you using, I guess?
So there were several.
Because that's a very physiological thing that happens across the board to varying degrees with all women.
That's right. So women experience hot flashes during the menopause transition. It has nothing to do with personality or stress, psychology.
Yeah, right. Yeah.
It's a medical, physical symptom. And breast cancer patients experience hot flashes in that sort of the breast cancer will feed on estrogen. And so there's certain medications that are given that basically stop estrogen production. And so hot flashes can be sudden and very severe for those women. The mechanism of hot flashes, like what causes hot flashes, is not exactly known. But what is known is that hot flashes occur when there is a dysregulation in body temperature. Body temperature is regulated by the hypothalamus. And so essentially what happens when a woman has a hot flash, is the brain perceives heat. And so the hot flash causes sweating, which is designed to cool the person down. And so with that understanding in mind, we sort of thought, okay, a hypnotic intervention that emphasizes relaxation would be of some benefit, but really to decrease the actual number of hot flashes, there has to be some way to regulate body temperature, the perception of body temperature, and that involves mental imagery for coolness. So in the hypnotic intervention, suggestions and mental imagery for coolness, such as walking through the mountains, a cool day with gentle snow, standing under a waterfall and feeling the cool water wash over your head, neck, and shoulders. Those kind of images are practiced once or twice a day through audio recordings and guidance. And what we found is that, I believe in a sense, these mental images, this within the hypnotic state, sort of tricks the brain that if there's no perception of heat, then there's no hot flash. And so what we found is that by practicing this for 3 weeks, hot flashes had decreased by over 50% on average. By 4 weeks, 70%. And then we followed women all the way out to 3-month follow-up. And we found that it's a physical symptom. So women really practice the self-hypnosis audio recordings on a daily basis. Hot flashes continued to decrease so that at 3-month follow-up, the decrease was 80%.
Wow.
And we measured hot flashes both by daily diary, self-report, but there's a device called the Biolog. It physiologically measures hot flashes. It will detect a hot flash through sternal or across the chest, skin conductance measurements. And so you can very objectively see whether or not an individual is having a hot flash. And so we demonstrated it wasn't just the perception of hot flashes that decreased, but rather it was the actual number of hot flashes. Hot flashes began to go away. And for many women, they went away completely with the continued practice of self-hypnosis.
Well, for something comparison-wise, like what would typical estrogen therapy do? How much would that reduce it? Like Of course,
75 to 80% reduction.
so it's the same, except there's no side effects.
That's right.
There's no negative side effects, no contraindications. Wow. Well, no physical contraindications, at least. Yeah. Wow.
That's right. In fact, the North American Menopause Society reviewed the literature and the evidence for clinical hypnosis for hot flashes and assigned level 1, which is the highest level of evidence and support, recommending clinical hypnosis as a first-line treatment for hot flashes. Well, that certainly gives women a choice.
Yeah, it does. And it's a healthier choice. And it's more control.
That's right. Our basic idea is it empowers the woman to be able to take control of her own physiology. And it had the added benefit of improvement of sleep. So, for example, one of the major problems with hot flashes during menopause transition or among breast cancer survivors are night sweats. So these are hot flashes that wake you up in the middle of the night with profuse sweating. And what we found is that we encourage women to listen to the self-hypnosis audio recording prior to bedtime. And night sweats, likewise, decreased dramatically.
Okay. Wow. Well, but what's mind-boggling is that, this is known to a certain degree in circles that practice hypnosis, but not entirely. And it's not really like basic knowledge with most PCPs, right? Family practitioners. Right. How many people who are OBGYNs know this stuff? And this is like, it's kind of mind-boggling. Not for me because I practice hypnosis, but but the idea that it is not really that well known. I mean, that's incredible. That's incredible data, and it's hardcore data. And for the fact that the North American Menopause Society gives you a level 1 for the treatment, and it's an easily teachable protocol. I imagine if you know hypnosis, it's pretty easy to learn the script and deliver it.
It is, and that was really part of the motivation behind developing the Evia app with Mindset Health. Is that we, just as you said, we developed this hypnosis intervention that's so effective, and literally millions of women need it, but hardly anyone knows about it. Certainly, it's not widely prescribed by oncologists and OBGYN physicians or family physicians, probably largely because they just don't know about it. And if they do, having access to the hypnosis intervention, who's going to deliver it? And so we found that it's really the intervention. It's not so much the interpersonal interaction with the therapist, although the therapist could help guide the individual, but the actual intervention is contained within the hypnosis intervention itself. And so the Evia app was developed based upon this evidence, the research that exists, and exactly, what is the intervention precisely that reduced hot flashes within the hypnosis intervention. And so the app is essentially a 5-week program, just like the research that we had done to date. The woman can continue to practice with the audio recordings. They receive a new audio recording every day, and the practice is about 15 minutes per session. So we try to make it convenient that, everyone has busy schedules. And so even 15, 20 minutes sometimes, takes some planning to have that time for the intervention to practice.
Yeah.
But it's now widely available and can be downloaded, through the Apple App Store.
Mm-hmm.
And, it's called the Evia app from Mindset Health.
Excellent. So, if anybody in the office, audience is a medical practitioner or health psychologist or something, they could recommend this to their patients.
They could, and further, Mindset Health, they're very tuned to meeting the healthcare needs of individuals. And so if there's a healthcare practitioner, whether that be a nurse, a physician, a psychologist, a therapist, they can actually prescribe. There's a kind of a prescription pad that they can use and provide to the patient. Patient basically scans that. And what that will do is the individual, the patient, they are able to enter the practitioner's email address.
Mm-hmm.
And so all of the data, the progress, the reduction in hot flashes, the improvement of symptoms, that data can be provided to the practitioner so they know how their client's doing.
Excellent. So the Evia app isn't just the inductions and the suggestions to bring the symptoms down. Is there also a way to track the physiological response of the reduction? And is there a diary as well?
Yeah.
Or
so
a Likert scale or something? Yeah.
Individuals complete a daily diary of
Excellent.
hot flashes that they record both the frequency and severity of hot flashes. They complete what's called a hot flash daily interference scale, the degree to which symptoms are interfering with their daily life, as well as measures of anxiety and depression. And these are both to provide feedback to the practitioner, but also for the individual using the app, they can actually see the decrease in symptoms. And of course, this is very encouraging.
Excellent. Yeah.
And I think helps people get engaged to maintain their daily practice. There's also self-report measures of sleep. And honestly, for many people, the concern about sleep is almost as large as the concern about hot flashes themselves.
Yeah. Yeah. I remember when my wife went through her period of hot flashes, she could have used the app, right? Definitely. Or if I had known the data at the time, I would have, grabbed the protocol or attempted to get trained in it to help her a bit. But it is disrupting of sleep and life in general. Yeah, it can be very bad.
It is. And it's a very strong statement for the uniqueness of clinical hypnosis. So, for example, there have been other studies funded by NIH that evaluated interventions such as mindfulness. Mindfulness had no effect beyond placebo effects on hot flashes. Relaxation-based interventions, similarly, had no effect on actually reducing hot flashes. They did measure what's called hot flash bother, like how much did the hot flash bother you, but it didn't really have any effect on the actual number or frequency or severity of hot flashes. Hypnosis is the only mind-body intervention that has achieved a clinically significant effect on these symptoms.
Yeah. I'm curious. I know that hypnosis, one of its high marks for interventions is also for pain management. But I'm curious, does the literature say anything about mindfulness? Because I know people are offering that now. There tends to be more people jumping on the mindfulness bandwagon. Whether or not it actually is mindfulness from where it comes from in Buddhist literature, or whether it's just some sort of relaxation training and suggestions. or also what would be specifically called relaxation training. How does hypnosis fare against those two other mind-body interventions, if you know?
So if you examine the various mind-body interventions, mindfulness, relaxation training, hypnotic inductions, they all achieve a modest benefit. And I would say that they're generally pretty comparable. So, if a person wants to utilize hypnosis, training in self-hypnosis, practice of work with a therapist and receive hypnotherapy for pain management, especially chronic pain, there's probably not a big difference among those. Where I think we see the difference in favor of hypnosis is in two areas. First is acute pain. Mm-hmm. So if a person is going to undergo a painful procedure, hypnosis generally involves suggestions for dissociation and analgesia, not just relaxation. And so research has shown that those analgesic suggestions can optimize, they can increase the effect of the mind-body intervention, in this case, clinical hypnosis. Mm-hmm. And then the second is hypnotizability. Many of the other mind-body interventions, they vaguely recognize that individual differences exist, but it's only hypnosis that really overtly considers that there are individual differences. Some people are highly hypnotizable. They're going to, be able to experience significant benefit after even one session in some cases, whereas others, they might need to have quite a bit more practice, more engagement, more individualization in order to achieve some of the same reductions.
Okay. Yeah. And well, speaking of hypnotizability, was there anything within the menopause work that you were doing with hypnosis? Was hypnotizability a factor in any of the studies that looked at that?
Yeah. So in that study, we examined both whether hypnotizability was a moderator as well as whether cognitive expectancies might be a mediator. And the cognitive expectancies, like some people think, well, for hypnosis to be effective, you've got to believe in it or something like that. And we found this to not be true. At least in the case of hot flashes, it didn't really matter whether the individual believed in it or they didn't believe in it, whether they expected or they didn't expect a benefit. Expectancies did not have any mediation effect. Compliance was important. So it doesn't matter if you believe in it, just do it.
Okay. Okay. And I assume that it is kind of a bell curve for hypnotizability in most populations. So most of us are moderately hypnotizable.
So we measured hypnotizability using the Elkins hypnotizability scale.
Tell us about that after you get done telling us about how you measured it.
I'd be delighted to. We did examine whether hypnotizability was a moderator. Uh-huh. So we examined the reduction in hot flashes among individuals who were very highly hypnotizable, in the medium range, or low hypnotizable. Okay. It was fascinating because at every time point, the individuals who were in the very high range outperformed all others. The effect size was bigger for those that were in the high to very high range of hypnotizability. However, the study was over 5-week intervention. And what we found is that over time, those that were in the mid-range and even the low range, they caught up. So by the time we got to the end of the 5 weeks, there was very little difference among the 4 groups.
Well, that's interesting. Now, you must have had some interesting discussions about that.
Yes.
Yeah. I mean, that's pretty interesting. So that means that the longer you do something, there's gain.
That's right. So
yeah.
It really indicated that, hypnotizability is a real thing. It matters, but everyone can benefit from a hypnosis intervention.
It's an inborn trait, right? Basically, it kind of stays pretty constant after your teens. It kind of drops a little bit lower, and then it gets a little bit higher later on. I think so. The literature says, and others might disagree, but it's basically pretty constant, just like IQ, right? Or aptitude for certain things. Like some people are really great at picking up languages; others they have to really work at it, but they can still do it because it's an innate capacity that everyone has.
Yes, and that's really our research really confirmed that to be the case, and
wow,
the comparison to IQ I think is exactly right. So, one of the studies that has not yet been published but has been accepted for publication is we conducted a factor analysis of the participants in regard to the Elkins hypnotizability scale. We found a general G factor, just like IQ,
right,
with subfactors, but that it really indicated that hypnotizability is, in fact, a talent, an abilities, much like IQ. It's not really a indication of suggestibility or susceptibility any more than we would say a highly intelligent person is susceptible to learning. They have the ability to learn if they so choose. That's a
pretty funny reframe, yeah. Oh my God, he went to a college class and he learned. He was susceptible to learning about that topic. Yeah. So it's a capability which kind of this is wonderful stuff. Tell us a little bit about the development of the Elkins scale, if you can, because I know zip about it. I just know you worked on it probably with a lot of grad students and other people helping you out, but or maybe you did it all on your own. I don't know, but tell us about that scale.
No, it was really a number of years in development, and what brought about development of the Elkins hypnotizability scale is up until recent times, the gold standard to measure hypnotizability has been the Stanford Hypnotic Susceptibility Scale, MC. And these scales were developed in the late 1950s, early 1960s. They're lengthy. They take it takes about an hour to administer, and it has items that were originally developed in terms of assessing hypnotizability in college students. So, for example, one item is amnesia to ammonia, and you give the person a suggestion that they won't be able to perceive any aroma. And a bottle of ammonia is put right under the person's nose, and they're told, take a big whiff of this. Well, if they fail the item, the therapeutic relationship might be, wounded. But also, I was conducting research with cancer survivors, and many of these items were just inappropriate to use with a vulnerable patient population. Mm-hmm. And so I felt that there was a need to develop a new scale that would be brief, meaning 20 minutes or less to administer, valid, pleasant for the patient or the individual who's completing the scale, and clinician friendly. In other words, something that a clinician could utilize and integrate within their hypnotherapy session without it being so burdensome to provide. And so those were really the driving factors that led to the development of the EHS, or the Elkins Hypnotizability Scale. The scale yields a range of scores from 0 to 12. Mm-hmm. And it has been shown to be more reliable than the Stanford Hypnotic Susceptibility Scale Form C. Equally valid, but much more brief, much more clinician friendly. And certainly some of the items, for example, instead of smelling ammonia, we give the person the suggestion that they're walking through a beautiful flower garden and they can smell a beautiful red rose. And the idea being that's an olfactory hallucination, but we don't have to put ammonia under the person's nose.
And no eye rolling or anything like that. Yeah.
No.
Does it, have you compared it to, I suppose you compared it to the Stanford and thereby the Harvard or the Waterloo, but what about like the hypnotic induction profile? Has that been any comparison with that?
I know the HIP has been used in a number of very rigorous studies. I don't know that the eye roll has been consistently shown to, predict hypnotizability, but the scale, the HIP, involves multiple components.
Yeah. Levitation, and, things like that. Yeah.
So I would say it's another alternative that clinicians can use. We have not yet done a validation with both scales. We've had individuals do both the Stanford Form C and the EHS, but not in comparison to the HIP.
Okay, and so they basically kind of, it's basically they're studying the same thing, so the validity, and it seems like it's kind of based on some of those ideas. Then, yeah. Yes,
I would say both are good, and
they correlate pretty well.
They do. I'm biased toward the EHS.
Well, you spent a lot of time with it.
I think it's so clinician friendly. But honestly, if there was a clinical study, I believe either scale or any of those three scales.
Well, you shaved about 25 minutes off of it. That's for sure. Which is good, right? And it's based on the gold standard. So it seems like it's something that people may take a shine to as clinicians because it's going to be less invasive.
Yes, it's designed such that the person in the clinical form, traditionally a hypnotic induction is completed, and then there's safe place imagery, and then you move on to some type of therapeutic suggestion. And so the EHS is designed that the person goes through assessment of different tasks, and then the suggestions of walking through or going through a flower garden, smelling this beautiful rose, and then the person's already in a safe place. So the clinician could very easily just transition right on into whatever clinical work that they wanted to do at that time.
Yeah.
And we have shown that just doing the EHS has therapeutic benefit. I mean, it's hypnotic induction, and it involves suggestions for relaxation, and it's very validating to the patient to be able to see their own response to various suggestions. And so it's not just a neutral, it has a therapeutic benefit in and of itself.
Excellent. Maybe we can kind of swing back to your book. Can you tell us a little bit about this new title?
Sure. So I'm very excited. My newest book is titled Introduction to Clinical Hypnosis, the Basics and Beyond. It was really based on a number of years ago. I was chair of a standards of training task force for the American Society for Clinical Hypnosis. And out of that task force, we identified standards of training across various domains that should be common knowledge, areas that individuals who are seeking training in clinical hypnosis should be able to have exposure to and an understanding. And so that comes out to about a 21-hour training program. However, I noticed that there was no book that covered each of these topics in a comprehensive, in-depth manner. And so I set out to invite chapter authors of leading teachers of clinical hypnosis around the world to contribute to the book. And I'm pleased to say a wonderful response from chapter authors. And so the book has 21 chapters that line up with the standards of training in clinical hypnosis.
Excellent.
And I believe the intent is that it will be a resource for individuals who are teaching clinical hypnosis workshops, as well as those who just want to read more in depth and learn more about these various topics that would underlie, such as principles of hypnotic induction, hypnotic phenomena, applications such as in pain management. Dr. David Patterson, who's one of the leading experts
in
hypnosis for pain management, contributed his excellent work. Dr. Karin Olness and Dan Cohen, both physicians and pediatricians with expertise in child hypnosis, contributed chapters. And so have chapters across a wide range of topics, but they're really driven by the standards of training in clinical hypnosis.
Excellent. So it could be used as a textbook or a follow-up, or it could just be something you could dive into as a clinician.
That's right. And, there's so much content that it's the kind of book a person would be likely to return to, depending on,
Is it perhaps you could say it's kind of an updating of the old Red Book that Corey Hammond edited?
Yes, that's right. It's somewhat more in depth in some areas in terms of content, and includes in the clinical chapters transcripts and guidance for addressing various issues.
Excellent. Okay. Well, is there anything else we haven't covered here? I know that you're part of a foundation, or you're part of a board of a foundation, I think, that works on post-traumatic growth. Maybe you could talk a little bit about that, because PTSD is a big deal and it's becoming more and more. There's a lot of awareness in the general society. Maybe you could tell us about that.
Yes, I became involved with the foundation as the Hillcrest Foundation. And this is an organization that has developed intensive programs for veterans with a history of trauma or post-traumatic stress disorder. The factors that underlie the development of the Hillcrest Foundation, today's Veterans Day. And I was reading an article in the newspaper this morning that was quoting that over 17 veterans die of suicide per day. More veterans have died of suicide than all that were killed during the Vietnam conflict war. And And so there are existing treatments for post-traumatic stress disorder, such as exposure-based treatments, prolonged exposure, and other current treatments, as well as medications. But many individuals do not complete those treatments, or they are not sufficient, and they don't address many of the issues that veterans experience upon return to civilian life.
Right.
And the Boulder Crest Foundation is based upon the post-traumatic growth model. Their programs are based upon the post-traumatic growth theory or model. This is an approach that was developed by two psychologists, Dr. Richard Tedeschi and Lawrence Calhoun at University of North Carolina. Their work was based upon, they were conducting research and clinical work with parents whose child had died. And they came to their understanding of post-traumatic growth based upon interviews and feedback from their research with this group. And essentially what the post-traumatic growth theory model presents is that when a person is exposed to some significant trauma that is so significant that it alters a person's worldview, their understanding of themselves, the world, their expectations, that it first leads to great disruption in the person's ability to function. There's a period of grief and just being traumatized. But from that point forward, the person can either be forever traumatized, or it can be the struggle to recover. The struggle itself can lead to growth, such that the person may have a deeper appreciation of life. Mm-hmm. They may see new possibilities, new directions for their life. It may deepen their spiritual understanding or their spiritual growth. It can even deepen personal relationships, such that, most people realize that relationships are one of the most important things in our lives, but the struggle with trauma may bring a deeper and a more complete awareness of just how important interpersonal relationships are. And so as individuals go through this intensive 7-day program, it provides an opportunity not just to get back to where they were, but to grow, to become greater in many ways than they were before. For a lot of individuals, it may not be possible to get back to where they were before. For example, if an individual is, serving in the military, they might have stepped on a landmine and lost a leg. They can't go back to where they were, but they can experience personal growth and find new directions for their life. And that's really it's a very intense program, but many people, even the concept of post-traumatic growth is important to consider, that when the person experiences great trauma, they are transformed. And the idea here is that the person can be transformed in a positive manner. Mm-hmm. Hypnosis or self-hypnosis training is an important part of this, because the person needs to be able to learn to regulate their emotions to achieve a sense of calmness. You've got to be calm enough to even think about these concepts. And then hypnotic suggestion can be utilized to facilitate many of these post-traumatic growth goals.
Excellent. So that's a part of it, but it sounds like a rather existential approach to things, and not in a nihilistic way, but in a kind of like, here's the cards we're dealt with, and now we can move on and appreciate what we have. Yeah,
that's right. Viktor Frankl's book, Man's Search for Meaning, in many ways is reflective of the post-traumatic growth process.
Yeah, exactly. Yeah, it's a classic book, and I often refer that to people to use.
So do I.
So, okay, well, maybe we should wrap things up here. Really interesting, engaging conversation. I really appreciate this, Gary. This is really getting, I've admired your work, but it really getting a chance to kind of dive in with you one-on-one personally is kind of fun too, to really to gain more insight from it. And I hope this has helped the audience. So the book is?
Introduction to Clinical Hypnosis, the Basics and Beyond, available through Amazon.
Excellent. And the app is?
2 apps from Mindset Health, the Evia app for hot flashes and sleep. And the second app is Finito, the Finito app, Hypnosis for smoking cessation.
Okay, well, you didn't even get into that. You could come back another time, because I know you've done some research on that. The other thing is, you have a website. We'll put the plug for the website as well, in case people want to look at, seek you out for more information about your work or you. But you do have a lab at Baylor University, and you've got some great grad students working with you and other folks on the premises. So shout out to them. Thank you for mentoring people in this important aspect of psychology, psychological hypnosis.
Thank you for having me.
Thank you for listening. We hope you enjoyed today's episode. Did you know you can find the Psychology Talk podcast everywhere? Well, maybe not everywhere, but you can find us on Facebook and Instagram, and we have a website, www.psych-talk.com. All material is copyright the Psychology Talk podcast. This podcast is for entertainment and informative purposes only. If you need a behavioral health specialist, please seek one out. Music is provided by the band Serenati.